Why are people who experience homelessness at higher risk during a pandemic?
Back in March of 2020, we were all told to stay home and stay inside and work from home. Okay. So, what do you do if you're homeless? Christy, we worked on the pandemic research project 10 years ago, which said really people who are homeless have no place to shelter in place. They've got no place to store food or essential supplies. They have no way of remaining socially distanced. You know, I think that people who are without shelter were at the greatest risk of psychological, moral, and physical injury during the pandemic because we did not have the resources to help them to shelter safely in place. And most homeless service organizations were left scrambling for what to do and how to do it because they had no plans in place. So, yeah, well, I mean, we already know from previous work that homeless people have much higher health issues um, than people who are sheltered. So the non-sheltered and provisionally or partially sheltered are at much greater risk in terms of not being able to do the self-protective things that they need to do. And that unfortunately really hasn't changed. I was last week or the week before, I was at the drop-in center in Calgary, which is Calgary's biggest homeless shelter, and they've actually they've provided more social distancing by having a couple of different sites where they're sheltering people, but there were still people sleeping on the mats, on the floors, on the first floor. Very little social distancing going on, and I'm going, this is not easy. Okay, or when you have now some cities, quite a number of cities, and some other smaller municipalities set up quarantine hotels for people who were homeless, who had tested positive, or who were showing signs and needed to be quarantined. And that the public health need for that was very clear. What we failed to consider, or what those providers failed to consider, is that just providing a place to quarantine doesn't take care of all of the other issues that come up. The first thing being that a lot of people who are homeless have also experienced interactions with the justice system or have spent time in jail. And being put in a quarantine hotel was like being put in jail. You can't come out, okay? Those places that did not have a harm reduction policy were faced with having homeless people who were used to smoking or using other substances being told that they can't use, okay, which doesn't make them want to stay at the quarantine hotel big time, okay. Local officials didn't necessarily want to take them off and force them into a forced hospitalization against their will because there was not necessarily a mental health crisis, but a public health crisis. So you have a whole bunch of conflicts going on. So, yeah, homeless people in the time of COVID had very few protections, um, and because they're out in the street, they're and in congregate settings a lot more than the rest of us, they're more likely to be exposed. And they have fewer protections also when other people are not wearing masks when they're supposed to be wearing masks. Okay, they are a lot more vulnerable. They're also more vulnerable because how often can they wash their mask if it's a cloth mask or get a clean mask if it's a paper mask? So, oh, we're having such a happy conversation. Sorry, but it's really bad out there. So,
Jeanette, I'm curious your thoughts. You mentioned the research that we did before, and that was related to H1N1.
yeah,
Do you think do you think that we learned anything from H1N1 that we've applied to COVID-19, or do you think we're in the same spot?
Christy, we learned the people who were supposed to get the message didn't get the message. Okay. So it was very clear. One of the things in my current study, we have done key informant interviews with with senior managers in all of the participating organizations. Okay, so we've collected over 40 interviews across the country. One of the ones that I did with the CEO of a shelter here in town. Um, her organization actually was pandemic prepared, but she's also been within the homeless system for the last 20 years, and she could honestly say most of the other agencies were not. She said we were prepared because we already knew it was coming, and the daughter of one of our senior managers was in London already saying this is what's happening here and it's coming your way. So they went out of their way to make sure that there were protocols in place, there was PPE. She said we'd already been through a fire and we'd been through a flood, so we figured the pandemic was next and we were just going to be prepared. But that proactive preparation didn't extend throughout the sector, and she said she had agencies coming begging for supplies and equipment to help them because they didn't have what they needed right at the beginning of the outbreak. So unfortunately, most agencies shelved the study. It gathered dust. It's unfortunate, but yeah,